The economic reality of oncology practices in general is that you're being measured whether you like it or not. And you're going to be paid differently based on how you're measured. So we need, as a group, to start paying attention to our own internal performance. That's number one. So how do you do it? And how do you do it in a way that's economically reasonable? I really go back to what started our success, which is really assessing and fixing the physician work environment. So, for example, if you have a low number of FTEs per doctor, and not too many practices do. Most practices have an excess number, but then you need to maybe look and see how you can better utilize and maybe add staff. So the economics in that situation, it would be more costly for the practice. But in most of the practices that we've done transformation work on, they have plenty of people. And what they have is they don't have a standardization of roles and responsibilities. Dr. X likes his nurse practitioner to do this, but she can't do that. Dr. Y doesn't want the medical assistant or the nurse to see the patient before he does. There's valueless variation in the practice. If you really address that, you can sometimes reduce staff. We went from 8.3 FTEs per doctor to 5.6. Now we had some other increased costs because of software development, because we were actively working on a software program that we live in 90% of the time as physicians. But our FTEs per doctor really declined. And most practices will achieve some efficiency in terms of staffing if they streamline, standardize, and as I mentioned.